Hey, are you awake? That's fine. You don't have to answer me for now. Let me just make sure that you're alive. Don't mind me talking to you, by the way. You must be pretty disoriented and scared, so I'm going to tell you about everything I'm going to be doing before I'll do it. Just in case you're actually conscious. Okay, first I'll check for a pulse. Good, it's there. A bit faint and definitely too fast, but I can work with that. Next, let's make sure you're breathing. Nice, I can see your chest rising. Good to know you're alive. I'll reassess your consciousness level now. It would be good to have you awake and alert. I'm holding your hand now. Try to squeeze it if you can. Nothing so far. Let me try this one last thing. I'm going to press down on your sternum hard with my knuckles and rub. It's pretty painful,
But it won't cause any Oh, that did the trick. There you are. Hey, calm down. I'm a medic, and I'm here to take care of you. Don't try to move too much. You are hurt pretty bad. Oh, and I'm sorry for the rude wake-up call, but I need you awake for this next bit. Can you tell me your name? Okay, nice to meet you. I'll do a quick neurological exam, but the fact that you answered me just now is already a good sign. Just follow the light. To the left. To the right. Up and down. Okay, all normal. Next, I'll take a look at your injuries. I see a lot of cuts and bruises, but I'm most worried about this gash in your leg. It's bleeding quite heavily. It's actually impressive that you were able to regain consciousness considering the blood loss. So, good job. We have to control the bleeding and do it fast, so bear with me, okay? I'm going to apply a tourniquet, which will hurt like hell. But you've already lost a lot of blood and your system won't be able to compensate for that much longer. I'll give you some pain meds afterwards, deal? First, I need to cut away your clothes so I can get a better view of the injury. Okay, that's done. I'm putting the tourniquet on now, okay? It's basically like a belt. Let me just get it as tight as I can. Yeah, shh, I know it hurts. You can squeeze my arm if you want to. I can take it. Okay. Let's take a little breather. I can't have you hyperventilating. I know you are in a lot of pain, and I'll give you something for that soon, I promise. Just try to focus on me for now and remember to breathe, alright? Breathe with me, okay? In and out. In and out. Now, are you okay to continue? No, I'm not done just yet, unfortunately. The bleeding has slowed down somewhat, but you're still losing too much blood too quickly. I need to tighten the tourniquet by twisting the handle. Don't close your eyes, look at me. Keep squeezing my arm. I'm almost finished. Okay, that's it. The bleeding has stopped. I'll secure the handle, and then I'll get started on those pain meds, alright? The worst part's over now. You did good. Hey, are you still with me? I can see those eyelids drooping. Try to keep them open. Here, I'll make it worth your while. Let me just prep an IV for you. Can you tell me your favorite animal? Yeah, take your time to think. I'm just going to disinfect your arm in the meantime. Anyway, I know the animal question might seem dumb, but if you want to keep patients conscious, it helps if you keep them talking. Also, I do like animals. Alright, keep your arm straight for me. You're going to feel a poke, and there we go. The meds should kick in pretty much immediately. I gave you the strong stuff. What is it? Everything all right? Ah, yes. Your favorite animal. Sure. So, what is it? Good choice. When's the last time you saw one? Yeah, just think it over while I wrap up your wound so we can start moving you. Huh. You sure are taking your time. I didn't expect this to be such a hard question.
Hey, hey! Damn it. You're fading quickly now. Well, to be expected, but still, I'm already going as fast as I can. Hey! I need a stretcher over here! Patient with a deep wound to their left eye. I was able to stop the bleeding with a tourniquet, but they lost a lot of blood. They were awake and alert up until a few minutes ago, but are now unresponsive. We'll have to move fast. Hey, I don't know if you can still hear me, but you are going to be fine. We'll get you in an ambulance now and take you to the hospital. You'll probably need surgery, but they should be able to save your leg. I'll be with you as long as I can, okay? Here, I'm squeezing your hand. Can you feel that? Yeah, we are en route now. About 12 minutes out from the hospital. Patient with a deep wound on their left eye. I was able to stop the bleeding in the field with a tourniquet, roughly 15 minutes ago. I estimate they lost around 1.5 liters of blood, considering they are starting to show early signs of shock. Yes, I'm worried about that too. We've got them hooked up at the monitor now, and they are hyposensitive with an elevated heart rate. Oxygen saturation is also a bit low for my taste.
Just be ready for us when we get there, okay? Whoa. Did you just move? Are you awake? Hey, easy. Don't try to sit up. We've done this before, remember? I'm a medic. The one who saved your life a few minutes ago, actually. I'm still trying to do that now. I told you I would stay with you, didn't I? Hey, calm down. I know you must be pretty disoriented, and to be honest, I didn't think you'd regain consciousness. It's a good sign, though. Means your brain is getting more oxygen again. So, good job. You're doing great. We've controlled the bleeding and we're giving you fluids to help with your blood pressure. We're also monitoring you closely, and the hospital is ready for your arrival. How are you feeling? Dizzy and cold. That makes sense, you lost a lot of blood. I'm afraid I can't help against the dizziness, but I can get you an extra blanket. There you go. Are you in any bad pain? Yeah, your leg. The tourniquet has to stay on tightly for now, but here, I can give you some more pain meds. I can't risk sedating you too heavily while your breathing is already this labored, though. I'm sorry. Still, it should help a bit. There. You should start feeling better any second now. No. Now's not the time to close your eyes, okay? We just got you back. Please try to hold on. Just focus on me and take some deep breaths with me, alright? In and out. In and out. In and out. Perfect, that's perfect. You see that blue number in the monitor? Up there in the corner? That's your oxygen saturation. It just went up a bit. Good job. Keep concentrating on your breathing. I'm right here with you. While I have you, I'll just check you for further injuries. Would that be okay? Let me pull up your shirt a bit to check your chest. All right. I don't see any obvious injuries and your ribs don't seem to be broken either. I'll move on to your abdomen now and apply some pressure right here. No pain. That's good. Means we might get lucky and won't have to be worried about any internal bleeding. Okay, I'm done with the exam. Good job. Here, I'll put the blanket back on. Ah, by the way, you still owe me an answer from before, remember? You don't? Well, you did pass out pretty much immediately after I asked, so I'm not surprised. Basically, you told me your favorite animal and I just wanted to know when you had last seen one. So, Ah, I see. Lucky you. Yeah, I like them too. They're cute. Hey, what is it? Your heart rate just went up. Is everything alright? Is the pain getting worse? Are you breathing okay? Shh, I know this is scary. Here, I'll hold your hand again, if that's okay. Is there anything specific you're afraid of? What's going to happen to you when we arrive at the hospital? Yeah, sure. I can tell you about that if it'll ease your mind a bit. They'll probably want to start with blood transfusions right away, which should make you feel a lot better. We've been giving you fluids to help compensate for some of the blood volume you lost, but those don't have the same effect as actual blood, of course. To do that quickly, they might need to set up a second IV on your other arm too, just so they can get you what you need more efficiently. It will pinch again, but the first one wasn't so bad, was it? I'll have to think what happens after that. It's not really my specialty. Oh, yeah. In the meanwhile, they'll check you for other injuries, like I just did. But they'll use way cooler technology like ultrasound. Not like this amateur hour over here with just my hands. After that, I think they'll start prepping you for surgery too. Hey, what's going on? Your heart rate just skipped. Are you afraid of the surgery? I get that. But you really don't have to be. The anesthesia will actually feel nice, I suppose, given how much pain you're in right now. And the best part is, they'll do all the work for you. You just have to lie there and sleep while they fix your leg. And when you wake up, you should feel much better, I promise. Shh. Everything will be fine, alright? Just keep squeezing my hand. I don't mind being your stress ball at all. Hey, your oxygen stats are dropping. Do you feel like you're getting enough air? No. That's okay, we can't help you breathe. Here, let me put this oxygen mask on you. Keep taking deep breaths for me, okay?
We're almost there. Stay with us. You are doing great. How far out are we? They're about to lose consciousness again and their breathing is way too shallow. 4 minutes still? Shit. Okay, just keep driving. I'm prepping an intubation kit just in case. Hey, I'm still here. You are in good hands, okay? I'll keep taking care of you. I promise.